Hey, welcome to What the Flip. I haven't done a segment for quite a while, been a little busy, but hope you're staying in and staying safe to help others save lives. Very important. Right now, we need to trust the science, we need to trust medicine. Too many people are getting out there and doing crazy things. That's kind of what I want to talk about tonight. Uh, I spent a lot of years as a consultant. As a consultant, we uh, we spend a lot of time trying to figure out how to make things work with organizations. And during that period of time, of course, strategy was one of the things we delved into. And so we used to hold sessions with people to develop strategies for crisis situations. For example, back in the 90s, early 90s, we did a session with a fast food group, a major fast food group, about what could happen to your meat supply. Well, 9 months later, or somewhere, maybe it was a year later, I can't remember, it's been a long time, mad cow disease hit England, and there was this big scare about having meat available. Well, this company that we consulted with had a plan, and they kicked it into gear the day after that announcement. They had press releases, they had strategies about what they were going to. They wasted no time getting something going. It's pretty obvious the United States government and this particular administration in particular has no such strategy. No such strategy. If they did, they would have kicked it into gear on January 23rd or 28th, whenever Trump said he first recognized it. Now, given that fact, I used to ask the question. We used to go through a whole like 3, maybe 5 days in some cases of strategy and looking at all the outside information, the inside information, the facts, and what was factual, what was hearsay, all that kind of information to define strategies to improve the business environment. We would get all the way through that, and we would have a fairly laid out strategy with action plans and mileposts and dates and times and measurements, and all that kind of stuff was in place, and it was all well laid out. And I remember, if you ever been to one of these sessions, it's kind of like we they get in on Sunday night or maybe Monday night, and they work through like Thursday and then Friday afternoon, and we're kind of wrapping things up. And about noon, just before maybe 11 o'clock or so, we're doing a wrap up, and we've reviewed everything, and we're showing every this part of the strategy, and what they've accomplished over those 3 or 4 days. And if you've ever been to one of these, you know that everybody checked out early, and they brought all of their suitcases and lined them against the walls in the meeting room. And they're all over there. Everybody's ready to jump, grab that suitcase, get out of the meeting, grab that suitcase, and run for their airplane so they can make it home and be home by Friday night. And I'm not a very well liked consultant at the end of those sessions, because after we went through it all, everyone, and my question was, are you really satisfied with this strategy? Do you think it will work? And the answer was yes. Yes, it is. And I always saved this for the last because I wanted it to be impactful on them. And it wasn't a popular question, and it created a lot of frustration with people. But down the road, it paid off. And later they came back and said, I'm glad you asked that question. So all these strategies are out there, like I said, and we've gone over them all. And this is 11 o'clock on Friday afternoon, and everybody was just about, we're getting ready to release them, and they were anticipating being released. They were kind of getting yancy, and I said, I just have one more question for you just before you leave. And of course everybody's thinking, how did the meeting go? Did you like it? Something like that. No, it wasn't that question. The question was, what's gonna f this plan up? What can screw it up? And I'd like you to just list a few things for me before you leave. Well, needless to say, many times for those people who wanted to be successful in their strategy and business, they ended up staying not only Friday night, but probably most of Saturday and leaving at 11 o'clock on Sunday because I had not thought about, and it was not part of their philosophy to think about what is the potential problem analysis with this strategy we've arrived at the end of the week. Now I could do that on Thursday afternoon, okay, uh, but it was always very impactful. I was always very interested because as much as they wanted to leave, once they did the brainstorming, which is about a half hour for the most part, on this strategy they built, they recognized how vulnerable it was in certain places if it didn't go just right. Virtually every strategy never goes just right. Okay. So this portion of the planning process is absolutely critical. The fact that they were willing to stay, and by Saturday afternoon, it wasn't just a willingness, it was an energetic desire to get these solutions in place so they could recognize if something was going to mess up this strategy. They could see it coming. And then they had the resources and the equipment and the plans and everything in place. So when they recognized it, they kicked it in. They didn't have to wait. It almost automatically kicked into gear. Okay, so I bring this up because we have a lot of, well, let me back up. What makes it easy for me to do this in a company is the company had a leader, the CEO. And the CEO and I discussed this philosophy before we went into the session. So he backed that philosophy. So it was a unified, top down, full organizational commitment to implement this strategic protection plan, so to speak, to protect the strategy. That made it easy. What makes it hard in the coronavirus is we have a bunch of states. Then we on top of that, we have individual states doing their own thing without maybe even having a strategy session. I'm not sure I see the earmarks of a strategy session for a lot of people. I see a lot of political people saying, "Hey, we're going to open this damn thing up to hell to high water. Whatever comes, comes." Okay, there's not much strategy to it. They then don't have a organized plan to open up. But worse, whatever plan they're putting in the gear doesn't have any potential problem analysis to it. Let me give you a prime example. So we have a lot of discussion going on in different states about how they're going to open up. And one of the dynamics of opening up is, hey, look, we're looking at cases, how many cases, whether there are new cases, how many, what is the bed capacity, the healthcare, all of these valid things to be looking at. Okay. The problem is this, that's where they stop. That's where they think they got it right there. So they've also got a plan to implement all of, these people are supposed to put in these guidelines. But then you got people who are saying, oh, we just want to use those basic guidelines that was issued by the president. And then you have people who are going, well, we really need to use the CDC very stringent guidelines. And for both of those guidelines, nobody's asking the question, what happens? What will F those plans up? Let's just define that right now. Let's just put out there a potential problem that these plans aren't going to work. Something gets in there and messes those things up. So what is it that does that? Now, the dilemma here is, like I said, I had a CEO and it was top down total commitment. So that organization was ready to implement. The problem here is you have 52 states with thousands of counties and thousands upon thousands of cities trying to make different opening and reopening plans based on whether the restaurants and the business in that community like the government, don't like the government. Some want to consider health and safety of people, the other want to consider making money, and if we don't make money, and then there's the idea, do you force people to go to work? All of those things are floating out there, but no solutions. But more importantly, no centralized total commitment. So here's one example I got. So there are a lot of them going county by county, even city by city, saying based on those measurement criteria, number of cases, number of new cases, hospital beds, those kind of things. If those are kind of in line, we're going to head and go open. And so they say, hey, look, let's just take where I live in Brighton, Michigan. There are not a lot of, there's 62 cases out of 8,000 or 10,000 people here. We don't see a lot of hospitalized cases out of that. They are doubling over a couple of weeks. They went from 32 to 60 something. So the trend is not, but relative to being widespread in the community, it's probably not the case. So if we wanted to open, I mean, if the Michigan governor just simply threw it up to every county to decide what they're going to do, like some of these governors are doing, then what could happen is in Brighton, they could say, hey, we're going to full service sit down restaurants. We encourage distancing. We encourage you to wear your mask, but you don't have to. And we're gonna try to take the temperatures. We're going to have a whole bunch of people who aren't trained to do that. Try to take your temperature. Like the temperature makes a difference, really? I mean, people aren't even experiencing temperatures that are affected, and they can pass it on 5 days until that temperature comes. Temperatures really aren't telling you much of anything, except somebody really might have it and not be asymptomatic, be symptomatic. So, what happens with screwing, what could screw that up? Well, an asymmetric person could come in and not have a temperature. What are you going to do then? How are you going to know that? How are you going to protect against that? Well, we don't even want to think about that. That is your problem. Then you have the whole scenario. Well, suppose we open this restaurant, this county up, this Livingston, Howell, and Brighton, and those small communities are really popular restaurants, really popular areas to go to. We open those up, but Detroit can't because Detroit is just obliterated with this. So they don't even come close to meeting the criteria, and they're not going to open up. So we're going to tell all the people in Detroit, some 40 miles away to the east, maybe 50 from Brighton, to the east, no restaurants, no haircuts, no church, nothing like this. But by the way, Brighton is open. So you live in Detroit, all this stuff's happened in Brighton. You feel like, you know, you've been, isolated, you've been discriminated against. I mean, if Brighton can open, why in the hell can't we open? And by the way, if they're open, what's to keep me from getting in my car and driving down to Brighton every weekend and having a really great time at a local bar or pub? What can screw this idea of going state by state, county by county, city by city? What can F that plan up? Just sit down and brainstorm all the things that can go wrong with that plan and ask yourself, how are you going to control that when it goes wrong? What are you going to do to ensure you're protecting the people in Bright and every other county or city that has very few cases? You could jump from like 60 to like 400 in a week. You know, how is testing going to look? I mean, what the F can screw up testing in Brighton versus Detroit? So if you're a city planner, and I'm frankly, I'm not seeing this from any city planners or any county commission planners or anybody else. I don't see their plan. They don't put that in front of me as a public on their website. I don't see it. I can't find it. I don't know what they're doing. It needs to be out there. Then we need to alert citizens in Brighton that, hey, if you open up and there's no statewide plan being enforced, it's county by county, where there's no national plan being enforced, which is even more important than a state, then guess what? You can expect an inundation of Detroit people into Brighton. Yeah, I mean, they're going to go. They're just going to go. They're not going to wait. So think about this. How stupid are we at getting this done? Just go back and take some basic planning steps, folks. First of all, get everybody's consensus in this county. And if you're in Brighton, get everybody's consensus in Brighton, not just the small business owners. Get all of the citizens, get all of the employees of those small businesses, get all the customers of those small businesses together and understand the total perspective of that. Now, I saw a survey on one of the sites. I have not seen, well, you can go and take the survey and look at the results, but it's like not even, last time I looked, there wasn't even 100 people respond to that survey. So this isn't something you can do that way. This is some kind of, mandatory survey. If you're living, you pay taxes in here, you need to provide us this information. And you need to engage your people, not at a city hall meeting. It needs to be a special meeting defining this special problem. Because you don't have a what the F can screw up stuff for Brighton? What can screw our plans up? Okay. All we have, and bless their hearts, they are a great chamber of commerce here in Brighton, but they're focused on just that, opening businesses. They're not focused on saving lives. There's nothing much about what they do is focused on saving lives, other than they're trying to help people understand what it takes to keep people safe if they come into their business. There's not a question of whether they should come into their business. It's not a question whether the resources that those people have, the type of employees, the equipment they have, the filtration systems they need to put into the restaurants or the facility that they go into. There's nothing along those lines, at least that I can see, that the public knows from a transparent perspective is going on, which would maybe provide confidence. And it could be that they're doing all of that. When they make it transparent, the public could be confident and say, hey, I'm ready to go back in and eat. The problem is you got all the people from Detroit saying that too. And what are you going to do about that? And how are you going to tell the citizens of Brighton, for example, this is how we're going to handle that if that happens? Because it would be a serious problem relative to the potential of increased infections in Brighton, serious infections in Brighton. Okay. So this is what I'm trying to say. You need to, before you open, you need to have not only a strategy for opening, but an involvement of your community in yours, not just some of your community, not just the businesses. Everybody in your community needs to be engaged in this process because everyone has to make that decision. If you want those businesses to open and have enough business to be successful and not have to close permanently because the government won't fund them right now. We have enough money in the treasury, in the Fed to fund keeping restaurants open, but people aren't using what they have. They can't get it because it's poorly administered. Secondly, when they get it, they don't want to spend it the right way. There's two funds. There's a payroll enhancement fund where you pay your employees to stay on, you pay them to stay on your payroll even though they don't come in work every day. They stay on your payroll, but they come off of unemployment. Okay. So they're on your payroll. They have 2, 4, 6 months, however much that time that is that we need. They're on your payroll. They're there. They're paying their bills. They're paying their rent. They're paying the stuff they need to do just as if they were working in your restaurant. You have enough money through grants and loans to keep your restaurants rent paid, electricity on, maintenance on, purchasing power, all of that kind of stuff that you need to keep your business. That comes through grants and it comes through low interest loans that could be forgiven down the road if you are, you know, keeping your people on the payroll and off of unemployment, all of which would be much simpler than having people trying to apply for unemployment after you fired them. Then you have to go back and find those employees and bring them back in if they're still there, or you got to retrain all the other employees. Everybody knows that's more costly in the long run. But we're not doing that. Now people don't want to have that program set up so that we mandatorily say so we can control and maintain employees on the payroll and pull them off of unemployment. They want to use that money to do other things. And the other things I'm not sure of, because if your restaurant is shut down for that period of time and nobody's going to come in there, then what do you need that other money for other than to pay your rent, your lights, and keep your building maintenance and those kinds of things? You don't need it for other things like putting in your slush fund as an owner. Okay, you can pay yourself a salary, just like you do your employees, and you should figure that salary, whatever you're earning, you should put that into the payroll structure. Uh, but you're just not taking large lump sums of money away for right now. Now, the alternative is for you to go on the way you're going, do it without all of this planning, watch things get screwed up simply because it's poor planning. It's not just even the virus of it, it's just poor planning. You open up, people don't trust you. You get 25% to 40% of the people come in. You can't jack your prices up high enough to cover that. Other 50%, you do that 3 months, 2 months, you're out of business. Then when you come back, you don't have a grant or a low cost loan. You can't pay your employees. Employees are now on unemployment. So, and they may be making more on unemployment than what's necessary to come back, which brings you to another question. Hold on one second here while I have some coffee. Perhaps while you're out, you need to rethink your pay structure and your incentive programs for your employees. Maybe you've been taking advantage of them. Just a thought. Just a thought. We're finding this out right now. It'll be interesting to see how Kroger deals with telling their employees, hey, you're going to go back to what your wages were. We've spent $7 billion on you. Is that really all Kroger can afford? And have they taken advantage of any loans or grants or money to pay their employees? I ask all these questions because they're simple questions. They're simple questions that any consultant who's working with somebody that's going through this would be asking the owner of the business. Have you done all of these things? Have you thought through the processes? If you're a government leader and you don't have any transparency because you don't have a plan, you got a problem on your hands. That's for sure. So, all I'm saying is, folks, you need to get your act in gear. You need to understand how to do this. It's not rocket science. It can be done by anybody, but it takes planning, it takes organization, it takes transparency, and it takes involving all your stakeholders. And that your stakeholders aren't just you, your bank, your suppliers, and your employees. It's every customer walks in there and every customer who won't walk in there that you need to walk in there. Every one of those are a stakeholder in your business. You need to think about that. So that's my message for you today. It's just amazing to me how I'm seeing people just throwing all of this stuff against the wall, hoping it'll fit. It's ridiculous, which speaks to what I consider the biggest failure of all about this coronavirus event. And it's not only affected death and lives, it's affected future livelihoods of people. And that is a failure of our government to operate and develop strategic plans to include potential problem analysis by asking what the F will screw this plan up, and then dealing with that and putting something together to make sure you're ready. If we'd have done that, I think we would have seen right off the bat in late January that we needed to do something February 1st. And if we would have had that plan in place, we could have executed on February 1st, and we wouldn't have over 90,000 dead people in this country. We wouldn't have uh, businesses on the verge of bankruptcy and failure. We wouldn't have hundreds of or thousands of employees, tens of thousands of employees on the street, not able to pay their rent, not able to, basically, in some cases, don't even have grocery money. We wouldn't have long lines at food banks. Okay. All right. Um, Fair warning, you can still have time to do this, but you better get your act in gear. And you better damn well be committed to it, because failure to do that will create deaths. That's why special operations units do this. They go through a plan, they rehearse that plan, they ask what can F this plan up before we go out, because we want to bring everybody back alive and we want the mission accomplished. It's really that simple, folks. Special ops teams do that all the time, and they have far less casualties than most operating units in the regular Army. Okay. So there you go. There you go. And even with that, they have to think on the fly, but at least they have a fighting chance to get out of it. All right. This is Victor Vogel. I'm on What the Flip, and this is something for you to think about. Stay safe, stay home. And if you're in a business or you're a business leader in a community or you're in a government position, get your act together, because I'm going to ask you, what are you doing? Show it to me. Then I'm going to ask a really clear question to you. What can F this plan up? And I expect you to have me an answer that basically shows that you've thought about that and that you're ready and you have the resources of people to implement whatever it is to deal with what screws your plan up. Okay. All right. Have a good evening.
You can like my Facebook page, What the Flip, and follow me. And stay tuned for more broadcasts of this podcast, What the Flip. Until then, have a great day.